So in this video, we're going to talk about the cardiac glycoside. In this slides, I just wanted to put some interesting thing about this cardiac glycoside and this drugs in the human beings been using these drugs for like last 200 years. Or well, maybe like 150 years, I guess, not 200 years, because they were first used in 1875. They are derived from the foxglove plant. That's the name of the plant. That's they were extracting these drugs from in old days. Now, they were used in dropsy in 1875. Started using in dropsy. What is dropsy? Dropsy is an edema. So whenever the patient had edema, they were giving this extract of this plant, and it was really helping in treating these edemas. Now, actually, it wasn't treating edema. These drugs treating heart failure. Now, one of the signs and symptoms of heart failure is edema. So they were giving these drugs to treat this dropsy, means edema. Actually, it was treating the heart failure, and they started using these drugs in 1875. So it's kind of interesting stuff. I just wanted to put in here. So let's talk about the mechanism of action of this drug. So there are only 3 drugs in this categories been used nowadays. Is digoxin, digitoxin, quinine. The mostly you may have hear the term is the digoxin, often used for heart failure and some other cardiac condition, which we'll cover in the next slides. But the first mechanism of action is increase the concentration of sodium and calcium ions in cardiac cells, and that will increase the force of contraction. And it also increases the vagal activity to the heart, which is increasing the parasympathetic nervous system flow to the heart, which will decrease the rate of contraction. That means the heart rate. Now, the second one is easy to understand. So like it increases the parasympathetic system, is going to decrease the heart rate. The first one we'll talk about in detail, and this mechanism of action is optional to understand. I'm just explaining so it make more sense. So this is a cardiac cell wall. Now there are many. Let's draw it right here. Now there are 2 phases of cardiac cycle. The first one is called depolarization. That means contraction when the heart squeezes. The second one is repolarization. 1. The ventricle relaxes. Now, in order to do a contraction and relaxation, the ion movement across the cardiac cells plays a really, really important part. So let's think this is a cardiac cell wall, and there are sodium channels already in the cardiac cell. It's called sodium leaking channels. What does that mean? There is a slight amount of sodium is always coming into the cardiac cell. So during the depolarization, what happens? This sodium comes into the cell slowly, and it builds up into this cardiac cell. Let's make the cell like kind of square. Now, when there is enough concentration of sodium in the cardiac cell, what happens is there's another channel. It's called sodium calcium channel. Now this channel doesn't require any kind of energies. When there is enough concentration of sodium in the cardiac cell, it opens this channel and increase the flow of sodium and calcium into the cardiac cell. When there is a high concentration, enough concentration of sodium and calcium in the cardiac cell, it will contract, cause the depolarization and contraction. Now in the repolarization, what happens? There's another channel. Not there are too many channels. I know it's kind of really like a little bit confusing, but if you pay attention really closely, it'll make more sense. So there's a channel. It's called sodium potassium channel. Now during the repolarization, this channel will close and this channel will open, and what it does, it actually throws out that sodium that came into the cell during the depolarization and brings in the potassium. So it throws out this sodium out and it brings the potassium in, and balance out the ion concentration across the cell wall. This medication, what they do is blocks this pump. So cardiac glycoside blocks this sodium potassium channel. That means sodium won't be going out easily and potassium won't be coming in easily. That means the increased concentration of sodium will stay in the cells. That means this channel will bring more calcium. More sodium, more calcium will cause increased force of contraction. I know this one's a little bit complicated, but this is how the cardiac glycoside works. As a nurse, you don't really have to know in detail this much, but keep in mind that that this sodium, calcium, and potassium ions plays a really important role in this cardiac glycoside mechanism of action. Because whenever we'll be talking about the side effects, we'll be talking about the ion concentration as well. Like high potassium concentration will do what to cardiac glycoside, or how low potassium concentration will do what to this cardiac glycoside. So that's the mechanism of action. Let's talk about in what disease condition we use this. Now, since we know this medication increases the force of contraction, it can be used in the heart failure, because the heart failure is basically a pump failure, and this medication will help heart to pump really effectively in order to get the blood out of the heart into the systemic circulation. This one also, since we know this medication also increases the parasympathetic nervous system or parasympathetic nervous outflow to the heart and decreases the heart rate, this medication can be used in atrial flutter with RVR and atrial fibrillation with RVR in order to control the rate, because they're going to decrease the heart rate. So the main use is in heart failure and to control rate in atrial flutter and atrial fibrillation. Side effects, the very important part of this medication and often tested in NCLEX. This medication will cause nausea, vomiting, and diarrhea, loss of appetite, anorexia, headache. It can cause anxiety. It will cause the blurred vision and yellowish vision, also called as halo vision. This is the really important side effects to know for this cardiac glycoside digoxin, and often tested in the NCLEX. Like, what is the first signs and symptoms of digitalis toxicity or high, like, so and they'll have several options. The first one is the blurred vision or yellowish vision, and anorexia is the first signs and symptoms of the digitalis toxicity. They're really important, and it can cause confusion and hallucination as well. So yeah, this one's really important to remember for NCLEX. Now we know this whole mechanism of action of this cardiac glycosides is based on sodium, calcium, and potassium. So these medications are contraindicated with the hypokalemia. The normal concentration of potassium is 3.5 to 5.2. Now, if a patient has a low potassium concentration or low potassium level, there is a high chance that they will get toxicity of these compounds. So hypokalemia causes the digitalis toxicity, and this is often tested question in NCLEX as well. They'll have like, okay, so which patients, the patients on digoxin, which lab values you should report to the physician, and there will be several values in the options, and one of them would be potassium 2.4, which is really low, because the normal is 3.5 to 5.2, and it can cause the digitalic toxicity. Hyperkalemia, so it's just opposite to hypokalemia, like it decreases the effectiveness of the medication. So like if you have a high concentration of the potassium, this medication will not be able to work. If they have a AV block, Wolff-Parkinson-White syndrome, or impaired renal functions, these medications are contraindicated. And another thing to remember about these drugs, they have a narrow safety margin. That means their therapeutic level range is really narrow. You can refer our therapeutic level videos in order to know more about this range. And they do the, like, if the patient is in the hospital, they do the digoxin level pretty much every morning in order to make sure this patient receiving the right dose of these medications. And also another thing I need to throw in here is, like, as a nurse, before you give this medication, always check heart rate. If patient's heart rate is below 60, do not give this medication and notify physician. So that's the important one to remember for NCLEX as well. Check pulse before giving this medication. It's not like radial pulse. You want to check the apical pulse. So you want to check the real heart rate. So make sure you do that one before giving this medication to any patient. So that was it about the cardiac glycoside. If you have any questions, you can email us and ask us. Thanks for watching this video. Thank you.